They're similar because they're similar. Just be very careful and read your little small print. You will realize that this is also, look, just look. They're the same. They are. Don't fall in love with color. Yes, I have, but please don't do it. The purple one and the gray one are the same, and the dosing is the same. However, when they put this one to red, it could be 500 on the highest dose of this. And this also can be dosed at 500, I believe. But check that with your prescriber. These both are twice a day. So if your insurance doesn't cover this, they may cover this, believe it or not. When you go get it, you're just looking at that small print and realizing the zone, which is the fluticasone, is the one that you got to rinse after. So if it's combined, you got to rinse after. And then the salmeterol is the albuterol component, which can make your heart a little bit racy. You got to rinse your mouth because they're both together, but you're really rinsing because of the zone. Be very careful. I am going to hopefully ask you to go look up how to use this on a different video, and I'm going to go over this one. Now, this one is very similar. You are going to use your finger here and you're going to open it. This is your cursor that you bring down, or your trigger. But before you do that, make sure you have enough supply. Mine is out. Yours may still have supply. You will then bring this down, and you have plenty of time to coordinate yourself. It's not like the MDIs. Be careful because these two are maintenance devices. They need to be scheduled. They need renewal every 12 hours. And they build on top of the next dose. Every sequential dose builds higher and higher levels of control. Treat it like lotion because you have to reapply, right? If you want lotion to work, you have to reapply. Same for these. They need to be reapplied. They are your rescue. They are the ones preventing us from giving you a lot of steroids and seeing you in the ER. So please be consistent if you're expecting them to give you results. Here we go. Just remember, exhale everything out, and then the number will not change until you close it and reset. But before we do that, if you felt like you interrupted your breath, maybe you didn't get all of it, guess what? You can exhale. One more time, and it's okay because you got everything now and you're sure. Now you can close it. When you close it, you see it's already resetting. And that when you open it, it's reset. And that's your next dose 12 hours later. Be careful. This one is a 250/50. If yours is higher or lower dosed, don't compare notes because they're different, and schedule them as they're prescribed. This is normally prescribed 1 puff twice a day, but check with your prescriber. This is Dr. Mkono, and I hope you're learning. I hope you're going back and checking with your doctors if you're controlled. I am wishing you all the best. If you're not, to check with your doctor and make them fix that. Sometimes we combine other medications and your rescues could be added to the therapy as needed. But if you're using them very frequently, maybe you need a higher dose. And that's something that we do when we see you and we do breathing tests on you and we listen to your symptoms. I wish you all the best. Take care. It's Dr. Mkono.